You remember Dr. Carden saying we needed to tell her what her specific diagnosis was before she went to the eye doctor? It's the most ridiculous thing I've ever heard in my life. She came to us because she was having vision trouble. She said it was getting worse the second time, and we told her to go to the eye doctor because you got vision trouble. That's why you go to the eye doctor, because your eyes aren't working good and you might lose vision. Do you really have to tell them, I think you have ICD-9 code 475, which is macular degeneration with a detached retina, or do you just tell them, go to the eye doctor because your vision's getting bad? But then he said we had an obligation to make sure she went. I guess we had to drive her. I guess we had to get an Uber. I guess we had to follow her around and make sure she had gone. How did we know she hadn't gone? We never heard back from her. And our doctor is seeing a lot of patients. If it was an abnormal test, they would have called our doctor or faxed the results over. But if it's not abnormal, a normal result wouldn't be communicated to you. We would never know whether she went or not. Did we get a phone call from the patient after the 17th saying, the 21st? And I hadn't even talked about the 17th. She clearly could have gone to Dr. DePoe. That's the same day she got her blood work drawn at the LabCorp, which is about 150, 200 yards from Dr. DePoe's office. She could have gone over there and kept that appointment and had a visual field test, which he said, everybody said, would have shown some abnormality of the blind spot, which had been called to us, which would have led to all these actions that they say should have been taken. So, what happened on the 21st? I'm not sure. I don't know if you'll ever know. But it wasn't Dr. Choi's fault. She went to the appointment and she didn't get her eyes examined. In an office where we know Dr. Freeman was there that day, we know he was doing visual fields, we know he would have done them in the morning. And we know, no matter what the paper said, visual fields and consult with every first patient who comes to his office, every new patient, they get a complete eye exam of the back of their eye with a dilated eye. So if she stayed around and been seen by Dr. Friedman, she would have gotten a dilated eye exam. Their experts say she had grade 2 papilledema by then at the worst, which would have shown up. You've seen the pictures of how obvious it is when the optic disc is not have the sharp lines and the sharp confines that normally have. It would have been detected either on the 17th or the 21st. Treatment could have been started. If they're right, all these injuries could be avoided.